Assalamualaikum and good morning to one and all. Today we'll study about part 2 of antacid and drugs for peptic ulcer. At the end of this e-learning session, you are able to discuss pharmacology of prostaglandin analog and sucralfate, explain pharmacotherapy of H.Pylori infection. So in last lecture we have studied about H2 antagonists. So we have seen the role of H2 antagonists like ranitidine, cimetidine, and we also study about proton pump inhibitors. So in today's lecture we'll study about these three categories of the drug. So the first category it is that we were studying in last lecture were reduction of the gastric acid secretion. So drug which reduces the gastric acid secretion. So first two category we have studied in last lecture. A was the proton pump inhibitors and B was the H2 antagonist which is used for the treatment of the ulcer. So today we'll see about the third category, that is the C, which are prostaglandin analog, example Misoprostol. So Misoprostol, it basically help in overcoming deficiency of endogenous prostaglandin, because there are certain drug like non-steroidal anti-inflammatory drug. When you give this drug for long-term treatment, especially which are needed for long-term treatment in different diseases like the peptic ulcer and those diseases, what happens? This drug it produces the deficiency of the prostaglandin because they inhibit your COX-2 enzyme. Since it inhibits the COX-2 enzyme, there is deficiency of the prostaglandin, and due to deficiency of the prostaglandin, there is no formation of the protective layer. So generally the protective layer which is formed on the mucosa of your stomach. So this mucosa of your stomach where there is formation of the protective layer of the prostaglandin. Since this NSAID it produces the deficiency of the prostaglandin, now there is no protective layer. As a result of that, acid or pepsin it come in direct contact with your mucous membrane of the stomach, and which may lead to formation of the ulcer, right? So what these drugs are doing, the misoprostol, it is a stable analog of prostaglandin E1. So analog means it having almost same structure as prostaglandin E1, which play important role in the formation of the mucus layer or in the secretion of the mucus which form the protective layer in your gastric gland. Okay, so since it form the protective layer, it can help your stomach to avoid formation of the ulcer due to excessive secretion of the gastric acid. So this is how misoprostol its work. Let's see about the pharmacokinetic, how it is given. It is generally given orally. The action, it is the direct action on the basal cell. So we know that the basal cells are responsible for secretion of the acid and the pepsin. So if it can act on the basal cell, there is no excessive secretion of acid and pepsin. As a result of that, it inhibits basal cell secretion of the gastric acid. So total quantity of the gastric acid which is secreted in the patient suffering from the ulcer, it is reduced. Secondly, it increases the mucosal blood flow. So that is another important part which play important role in the healing of the ulcer. Now suppose once ulcer is formed in your stomach, now for healing of this ulcer, the important thing needed, it is the proper blood supply, because through blood supply there are many endogenous healing compounds which are needed for the healing, and the repair are provided or they are supplied to the stomach. As a result of that, it help in improvement or it help in healing of the ulcer. Thirdly, it augments secretion of the mucus because it having the structure similar to the prostaglandin E1. So it increases the secretion of the mucus and also the bicarbonate, and overall result of this is the protection from the formation of the ulcer, because it inhibits acid secretion, it increases the secretion of the mucus, it raises the pH by secreting the bicarbonate, because when bicarbonate is released, it will help in raising the pH, right? So pH will move from a very stringent acidic towards the basic or towards the neutral. So when pH it is more towards the alkaline pH, then what will happen? There is no possibility of formation of the ulcer, because ulcer is formed at very high acidic condition, which is the pH produced due to the excessive secretion of HCl or the acid. Let's see what are the unwanted effects. So unwanted effect, for the first unwanted effect, it is the diarrhea. These are, although these drug, it help in protecting your stomach from the formation of the ulcer, but it produces the diarrhea, which is one of the problem. It produces the abdominal cramp, and it also produces the uterine contraction. So on smooth muscle, basically it produces the contraction that is responsible for cramp in abdomen due to the contraction of your intestinal smooth muscle, and in uterine it produces uterine contraction. As a result of that, the drug which produces the uterine contraction, these drugs should not be given during pregnancy, because in pregnant women if you give this drug, what it will do, it will lead to premature delivery of the baby, where you don't want the contraction when there is the baby, it is growing in the mother womb. You want contraction during delivery of the baby, but if it's happen in between, it may lead to premature delivery of the baby. That is not good. So to avoid that, generally these drugs are not given during the pregnancy because it produces the uterine contraction. So these are the unwanted effects which are related to prostaglandin analog. So drug we have studied, it is the Misoprostol. Let's see what are the clinical uses. So Misoprostol, it is used to promote healing of the ulcer and also to prevent gastric damage that occur with chronic use of the NSAID. So one thing is that the patient is suffering from the ulcer and cause is not related to non-steroidal anti-inflammatory drug. So in those cases, once ulcer is formed, so to heal the ulcer, you need the drug which can reduce acid secretion, and also it must provide the protective layer, so that there is, although acid secretion is there, it is not coming in direct contact with your mucosa of your stomach, right? So if you see the pharmacological action, it provides both this advantage. Thirdly, since it also improve the blood supply, it help in quick healing of the ulcer. So this is the one important use. Secondly, in case of chronic use of NSAID, so as I have already mentioned, so you are giving the NSAID for the chronic treatment of arthritis and many underlying disorder where NSAIDs is needed for more time. Okay, so you are giving chronic treatment with the NSAID. So since it inhibit COX enzyme, there will be deficiency of prostaglandin in the stomach, and the mucus protective layer there, or the level it is decreased, or there is no mucus layer it is formed in your stomach. Okay, so to prevent that also you can give prostaglandin analog. So these are the clinical uses. Second category of the drug, it is neutralization of gastric acid. So what we have studied in first category, so first category of drug, all those drugs which protect the contact of your acid and your mucous membrane of the stomach, or it directly inhibit excessive secretion of the acid. Now second category of the drug, the beauty of this category of drug is that they are not affecting on the quantity of acid secretion. What they are doing, they are neutralizing the gastric acid secretion. Means whatever gastric acid it is secreted into the stomach, it will be neutralized by this drug. So if you see the nature of this drug, like magnesium hydroxide, magnesium trisilicate, aluminum hydroxide gel, all these are basically alkaline in nature, right? Since these having the alkaline pH, when acid come in contact with the alkali, there is formation of salt and water. This is how acid get neutralized. So same mechanism it is used in case of the antacid to neutralize excessive level of the acid secretion in the stomach. Let's see the mechanism of action of this drug. So what they does, obviously since these are basic in nature, they neutralizes the acid which is present in the intestine, or whatever acid is secreted, all acid will be neutralized in presence of this drug. Secondly, they also raise the pH of stomach. Since the pH of stomach it is raised, what will happen due to this? There will be inhibition of activity of peptic enzyme. Okay, because for peptic enzyme to work, there must be pH which is below than 5. So if you increase the pH, so when you increase the pH, pH will move from 3 to 5 and 6, and pH will go up to the 6. And when the pH going up to the 6, up to the level of the 5, then what is happening here? It inhibit activity of peptic enzyme, because their activity, it is practically ceases at pH 5. When the activity of peptic enzyme it is ceases, it will not further stimulate your basal cell to secrete more acid into your intestine. Okay, so this is what this is how these drugs it produces antacid action, or it work as antacid by neutralizing acid and ceasing the activity of the peptic enzyme due to increase in pH of your GIT. Okay. Second drug it is magnesium hydroxide. So the drug, their pharmacological action, it's depend upon what type of salt it is. So if you use the different salt, it provides some additional advantages. So let's see how it's work. For example, in case of magnesium hydroxide it is the insoluble powder that form magnesium chloride in the stomach. So obviously when HCl it is your acid, when it come in contact with the magnesium hydroxide, there is formation of magnesium chloride, which is the salt, plus formation of there is water. So there is formation of the salt and water. So there is formation of magnesium chloride in the stomach. When magnesium chloride is formed in the stomach, it will neutralizes the acid. Okay. Let's see what are the advantage. So advantage of magnesium hydroxide is it does not produce systemic alkalosis, because the problem with all the alkaline drug is that when it goes into your systemic circulation, it may increases the pH of the blood and it may lead to systemic alkalosis, and that is not good and that is not advisable. Since magnesium hydroxide it is an insoluble powder, so what is the advantage? It does not absorb into the from the intestine and go into the systemic circulation, and as a result of that it does not produce systemic alkalosis, because magnesium it is poorly absorbed from the gut since it is a insoluble powder. So it will not absorb from the gut. Okay, so that is the very good advantage of the magnesium hydroxide. As a result of that, it produces the local action in the stomach. So there is no systemic action. There is no systemic side effect. So it producing local action which is actually needed in the treatment of gastric ulcer. Okay. Next drug it is the magnesium trisilicate. Again, magnesium trisilicate it is the insoluble powder. It reacts slowly with the gastric juices, and what gastric juice contain? Gastric juice contain either pepsin or it contain the HCl. So there will be formation of the salt and water, and since it increases the pH, the pepsin activity will be ceases. So this is how the magnesium trisilicate it work. So obviously when magnesium trisilicate it react with the HCl, again there is formation of the magnesium chloride, and additional thing it form is the colloidal silica. Okay. So what advantage it provide? It has prolonged antacid effect as compared to magnesium hydroxide, and another important thing is that it also absorbs the pepsin. So it provides two-way action on the pepsin. First thing is that it increases the pH and ceases the activity of the pepsin. Second thing is that it itself absorbs the pepsin. So whatever residual pepsin is there, which may be present in active form, will be absorbed by the magnesium trisilicate. Since it neutralizes the acid, it has inactivated the pepsin by raising the pH and also absorbed all residual pepsin. Almost all damaging effect of the excessive secretion of the gastric juice and the acid, it will be neutralized by using magnesium trisilicate. Let's see what are the clinical use. So we are using in case of the dyspepsia. Secondly, we can also use for the treatment of symptomatic relief in peptic ulcer. So what could be the symptom in peptic ulcer? We have seen there is only one symptom in case of peptic ulcer. So once that is the burning sensation, especially which happen during night or when you consume the food, isn't it? So suppose if you consume the spicy food, you may be suffering from very severe burning sensation. So if you have that problem and that is sometimes which is unbearable burning sensation, then to have the symptomatic relief from that, you can use the antacid, generally which is present in the syrup form. So you can just have that syrup before taking the food so that there is no burning sensation. So this is how it provides symptomatic relief in case of peptic ulcer. It can be also used in case of esophageal refluxes, because sometimes we have seen due to increase in a gastric volume, there is possibility of the backward movement of your acid from stomach towards the mouth. So when the acid is moving, or the gastric juice or gastric content, it's moved from the stomach towards the mouth. So in process, what it will do, it will come in contact with the esophagus, and as a result of that it will produces esophagitis. There is inflammation of the esophagus due to direct contact of the acid which has happened due to esophageal reflux. So how it will reduce this, because since it neutralizes the acid, the volume of your acid will reduce, isn't it? And also, although there is gastric reflux is there or esophageal reflux is there, it will not produce as the erosion because you have neutralized that acid, right? So now whatever content going back due to the reflux, now it won't produce as the erosion and it won't produce as the ulcer in esophagus. So it is also used in case of patient who are frequently suffer from esophageal reflux. So next category of the drug, it is the ulcer protective drug. So we'll see one of such drug which is called as ulcer protective. Example of the drug belong to this category, it is the Sucralfate. Let's see how Sucralfate it produces ulcer protective effect. So what it does, it is basic aluminate salt of sulfated sucrose. So Sucralfate, if you see their chemical structure, it is the basic aluminum salt of the sulfated sucrose. So when the Sucralfate, it come in contact with the low pH. So obviously when there is excessive secretion of the acid is there, the pH it is less in the body. So pH it is less than 4. So when it's come in contact with the pH which is less than 4, it is polymerized. Okay, so it polymerized at pH which is less than 4 by cross-linking of the molecule. So by cross-linking of its own molecule, it undergo the process of the polymerization. And what happened due to polymerization? Due to polymerization, it forms sticky gel-like consistency. So now there is formation of the sticky gel-like consistency which will preferentially and strongly adhere to the ulcer base. So wherever there is ulcer is formed, there only it will go and it will adhere. So when it's adhered to the ulcer base, so what will happen due to that? Now the acid will not come and in direct contact with the part of your mucous membrane of the intestine where there is formation of the ulcer. So wherever in a gut there is ulcer is formed, there it will form the protective layer, and now your acid will not come in contact and it will not further aggravate or it will not further complicate the ulcer formation. Otherwise what happens in earlier case or at early stage, the size of ulcer it is very small, but if you not give this ulcer protective drug, then there is increase in the size of the ulcer and it may produce the complication. So it can be prevented because it will adhere to the ulcer base. So this is their first mechanism where it undergo the process of the polymerization and form sticky gel-like consistency. The second mechanism by which it acts is it precipitate the surface protein. So since it precipitate the surface protein, due to precipitation of the surface protein at the ulcer base, it again help in formation of physical barrier which will prevent acid, pepsin and bile from coming in contact. So there are two ways by which it provide the protection. First thing is that it undergo the polymerization and form sticky gel-like consistency which will preferentially and strongly adhere to the ulcer. So this is the first layer. Second layer, it is formed due to precipitation of the surface protein. So now it will go there and it will form the sticky gel-like consistency, and the moment when it stick to the ulcer base, there it will go and further precipitate their surface protein. And due to precipitation of the surface protein, which is called as astringent effect, there will be the tightening of the ulcer, right, and further formation of one more layer due to precipitation of surface protein, and overall effect is it will prevent acid, pepsin and bile from coming in contact, and thus it will protect your ulcer, right. So this is very good advantage by which the Sucralfate it works. So basically after this process, the dietary protein which is present in your diet or whatever food you consume, it will also deposit it and form the coat, and it will form the another layer. So now you can see there are three layer protection it is formed. The first protection it is provided due to polymerization and it formed the sticky gel-like consistency of the Sucralfate itself, which will preferentially and strongly go and bind to the gastric ulcer. Secondly, after binding to the gastric ulcer, there will be the precipitation of the surface protein. So this is the second layer is formed due to precipitation surface protein. And thirdly, whatever dietary proteins which are present in your diet that you have consumed will also go and deposit on this coat, and it will form another layer, right? So this how it will ensure the protection of the patient from the ulcer. Let's see the pharmacokinetics of the sucralfate. So, as far as the absorption is concerned, it is minimally absorbed after oral administration, and its action is entirely local in nature because it doesn't absorb into systemic circulation. It is remains there. It stick specifically to the part of your gut where there is formation of ulcer is there. Okay. Thirdly is that it's promote healing of both duodenal and gastric ulcer. So we have seen the ulcer, it is may form in your stomach called as gastric ulcer, and ulcer may also form in the duodenal, that is called as duodenal ulcer. So it help in promotion of promoting healing of both duodenal as well as gastric ulcer. So this is about the pharmacokinetics of the sucralfate. Last category of the drug, which is specifically used for the treatment of H. pylori infection. So one of the reason for formation of the ulcer, it is the H. pylori, that is the bacterial infection. And sometimes what happen, we are keep on giving antacid, we are keep on using proton pump inhibitor, H2 inhibitor, or maybe ulcer protective drug, but the ulcer is not getting healed, and the patient is not getting rid from the ulcer in spite of the chronic treatment with different ulcer protective drugs. So in such cases, if that is the case, then you can diagnose that patient specifically for H. pylori infection. It's quite possible that the patient is suffering from H. pylori infection, and since he is suffering from H. pylori infection, the H. pylori, that is the bacteria, it is producing the ulcer, isn't it? So let's see about the H. pylori infection and how to give the pharmacotherapy in case of this type of infection. So let's see about the who to be given the treatment with the H. pylori, or which patient to be treated with the H. pylori infection. So the patient who have documented H. pylori infection, maybe they are having the history of H. pylori infection, and along with that, if they are having the symptom or maybe the evidences of duodenum or the stomach ulcer, so that patient can be given with the pharmacotherapy of H. pylori infection. Secondly, you can also give this treatment in a patient having family history of the stomach cancer. Okay, so if those patients who having family history of the stomach cancer, maybe parents having family history of stomach cancer, and if you are suffering from the chronic ulcer formation, you have tried in many treatment but you are not getting healed, it indicate that due to the stomach cancer, or which having the family history of the stomach cancer, their gut, it is at high risk of H. pylori infection. Okay, so in such case also you can think of giving the treatment which is given for the patient who is suffering from H. pylori. Okay, so you can consider the treatment if there is presence of severe histological gastritis, along with there is also the evidence of the H. pylori, which is generally seen when you do diagnostic test of your stool. So when you send stool for the culture test, and in culture test you see that there is H. pylori infection, and in diagnostic imaging study, you have observed that the patient is suffering from a very severe gastritis, right? So there is the inflammation of the GIT called as the gastritis. So if this is the case, then those patients should also be considered for this treatment. And secondly, if patient having ulcer like dyspepsia in absence of ulcer, means there is no ulcer, means there is histological evidences suggest that there is no ulcer, patient is not suffering from the ulcer, but he is suffering from the dyspepsia. In those patients also you can think of giving the drug which are generally given for the treatment of H. pylori infection. So this Helicobacter pylori or the H. pylori, it is generally naturally found in the stomach of many people, but it may not produce as the ulcer in those patients. So we have seen like the patient having family history of the gastric cancer, those patients, although the H. pylori, it is present in case of normal patient, but it won't produces the ulcer. But in those patient, it may produces the ulcer, right? So this could be one of the problem. Second thing is that it can cause the inflammation, which may leading to the membrane erosion. So you must also consider the treatment of the inflammation of the gut. So that is called as the gastritis. So when you are giving the treatment, your drug should be given to eradicate H. pylori infection. You are also giving treatment for the inflammation, and you also see that there is no excessive release of the acid secretion. So generally when you are giving treatment for Helicobacter pylori, there is not a single drug. So you are giving combination of the drug therapy so that you ensure that there is eradication of the H. pylori infection. Also there is the symptomatic relief to the patient. So these are the treatment options you can try. So where most of the time you can see there are two antibiotics are given with the proton pump inhibitor. So omeprazole 20 milligram, which is proton pump inhibitor, plus clarithromycin 500 milligram, plus amoxicillin 1 gram for 10 days. So if you look at the dose is also very high, because generally most of the time H. pylori infection in the patient, it is resistant in nature. So if any kind of bacterial infection which is resistant in nature can be treated only by combination therapy. So one antibiotic may not work. So you are giving combination of the antibiotics. Secondly, you can try with the lansoprazole 30 milligram. Again, this is the proton pump inhibitor, plus clarithromycin 500 milligram and amoxicillin 1 gram for 10 days. So what change you have made here? So these dose you have kept constant, as clarithromycin 500 milligram is same, amoxicillin 1 gram for 10 days, it is same. What you have changed the proton pump inhibitor. So depends. Or some patient you can give omeprazole, sometime you can try with the lansoprazole. So physicians has the flexibility to prescribe with different proton pump inhibitor. Third thing, you can also think of bismuth subsalicylate 525 milligram, which is generally the ulcer protective drug. You can also add metronidazole 250 milligram, tetracycline 500 milligram. So this is given for 14 days. You can also add H2 receptor antagonist for 4 weeks. So first 14 days treatment or 2-week treatment, it is with bismuth subsalicylate, metronidazole 250, tetracycline 500 milligram along with H2 antagonist. And once this 14 days treatment is over, then H2 receptor antagonist can continue further for 2 weeks. Okay, so this is how you can try. So depending upon the treatment, the response of patient to the treatment, and further diagnostic of the H. pylori, whether it is eradicated or not, you can try the different combination of the antibiotics, the ulcer protective drugs, or the drug which can inhibit the release of the acid in your stomach. Okay, so this is all about the pharmacotherapy. So when you are giving pharmacotherapy of H. pylori infection, you must consider different factors which determine success of H. pylori therapy. So what are those factors? So first important factor, if you see the pharmacotherapy, then you have seen that you are giving antibiotics at very high dose, and the treatment, it is long term. It's not like 1 day or 2 days treatment. You are giving treatment for long term. Since treatment, it is long term in nature, here patient compliance or non-compliance, it's play very important role. Because sometimes what happen, patient may start the treatment and he may suddenly stop the treatment with the H. pylori infection. When he stop the treatment, then it may happen that there will be the relapse or reoccurrence of this infection, which may contribute to the ulcer formation. So one of the important factor that must be monitored, it is patient compliance. So if you know that patient is not comfortable with your drug therapy, then you can switch over to another combination which can be comfortable to the patient, or which can have less side effect and tolerated by the patient. So this is important point. So the patient compliance, it is basically related to medicine side effect. So if patient having certain side effect, so to reduce that side effect, what patient does, he will avoid the medicine. And if he avoid the medicine, then there is no complete eradication of H. pylori therapy, right? H. pylori infection. So the medicine side effect should be minimum. So you can try the drug which can be best suited to that particular patient. Maybe suppose some side effect it is seen in one patient, so with one combination, it is not necessary that the same side effect is seen with another combination. So you can try out another combination so that it can reduce the side effect of the treatment. Secondly, second important thing, it is antimicrobial resistance of infecting H. pylori strain. So now what you can do to ensure this, if to see that whether your H. pylori strain it is resistant to this or not, you can conduct antibiotics resistance test. So in antibiotic resistant test, you will come to medicines which are resistant to H. pylori strain, right? So you can choose the antibiotics which is where your H. pylori strain it is not producing the resistance. So you can select upon the H. pylori strain that patient suffering from. Okay. So third thing, it is the duration, very important, because you know that any bacterial infection can be healed only when you are giving the antibiotic combination for the long term or needed for complete eradication of that bacteria. Now suppose if instead of 14 days patient has stopped treatment after 7 days, now what will happen due to that? There will be reoccurrence of again H. pylori infection, which may again contribute to the formation of the ulcer. So duration of therapy is very important when you are giving treatment to the patient. Then correct the dose. If you have seen the amoxicillin, you are giving the 1 gram, which is very high dose. So that maybe that is 1000 milligram dosing is very important. So you should give the correct dosing of the drug and pharmacotherapy, and which is for complete duration with correct dosing. In spite of that, the clearance of H. pylori infection is not equivalent to eradication. So this is very interesting, that although sometimes what happens when you give this combination of antibiotics and when you do the culture test, in culture test negative result, it show that the H. pylori infection it is clear out. It is not now it is, remember, clearance of H. pylori infection is not equivalent to eradication. What it means, the resistant form of H. pylori bacteria sometimes it present in other form, like in spore form, which is present in your stomach.